partially, despite the efforts of the state governor, there's partial respect of the recommendations made by the states. Apart from the city center, and when you go out of the center, you see people moving about. And what I can say is that increasingly people are using face masks. That's what I would say. But the lockdown is not total. It's partial.
Okay.
But the observance is partial.
Okay. Thank you, Doctor, and I appreciate you for speaking with me today. I know it's a public holiday, so Baraka de Sala, you're taking out time to speak with us this morning. All right, let's get started. Doctor, just succinctly characterize for me the strategies so far which we've used in fighting this COVID-19 pandemic. Give me your own characterization of how we are as a country tackling this.
Well, since the first index case was discovered in Lagos, certain measures were put in place by the Nigerian government. For example, we closed the borders, both land and sea borders, we closed them. Our government schools were closed. All businesses, big and small, were also closed. Social gatherings were banned. Worship, churches, mosques were closed. People were encouraged to stay at home, not to come out. Testing started of symptomatic patients. They started. From then on, we moved into intelligent lockdown. Some people will call it modified lockdown or eased lockdown. Now, having done all these things, I think we have to ask ourselves whether we have actually achieved our own objectives. In doing that, we have to look at, for example, the 5 stages put in place by the World Health Organization and see and actually compare it with what we have been doing to see whether we've made considerable progress. Number 1, what are these 5 components we are expected to actually meet in order to say we have made considerable progress? 1, we have to arrest, the control, the spread of COVID-19. We have to control the spread. 2, we have to improve the capacity of our health system. 3, we have to minimize the spread in the hot spots areas. For example, like Lagos, like Kano, like Abuja, I can even say Kaduna. Now, what preventive measures have we put in place in schools, workplaces, market, and so on and so forth? And are the communities in Nigeria actually respecting the various recommendations made by state government, what they are expected to do? In other words, social distancing, wearing of mask, identifying those who are symptomatic, and so on and so forth. All these things have to be put in place. And if we look at what has happened so far in Nigeria, we have not been able to actually stop the spread of the virus. In fact, it has not even picked up. Maybe in the next 2, 3, or 4 weeks, it will pick up. Now, apart from that, we have to also look at the capacity of our health system. Our health system is below capacity. Many of our, in fact, before I came on air, I called a doctor who works at the ABU teaching hospital. He told me that 10 of the doctors, came down, and the 4 were released, and yesterday 6 more were down. And what was the reason is precisely because they were not properly equipped. The PPEs are not there. And if the PPEs are not there, our doctors will also be infected. And as a result of that, some doctors are even running away. They don't go to the hospital at all. patients are also running away, they don't go to the hospital. So there is a problem there. Are we testing enough? No, we are not. We have not been testing enough because of many factors. We started late, one, and secondly, the shortage of test kits. Globally, even the United States, Great Britain, and so on and so forth have difficulties. And so we have difficulties in this area. Testing, detection is also poor. Testing is poor, and tracing of those who are symptomatic, is also been very poor.
Okay, okay, doctor, if you can hear me, let me just butt in here a bit, and we will take a break now because I'm not getting a full picture of you. The picture we're getting from you, it's not too good. So let's quickly take a break so that you can, okay, if you put it like this is better. I would need you to, put your camera, let it be stationed so that we can see you well. Let's quickly take a break, though. When we come back from the break and the program continues, of course, Dr. Abubakar Siddique Mohammed is joining me. He's the Vice Chairman at Anap Foundation think tank. Let's quickly take a break. We'll be right back.
Be characterized as a pandemic.
This is where we give you the economics of the pandemic.
The nature of this pandemic has very significant impact on public health. No one person, no one individual, no one company can basically rise up against this pandemic.
We even started weathering the storm economically. So many challenges for Africa at this time. How quickly are we going to see businesses adapt?
All countries can still change the course of this pandemic.
We must interrogate ourselves after this and say, what lessons have we learned about our healthcare system?
The scale of this is huge. You've created several new layers of unemployment through the lockdown.
So there are multiple dimensions of this problem that it requires bold and creative steps in order to resolve. If we need to have a homegrown solution.
It's about lives and livelihoods. How do we deal with all of that? All right, welcome back. Dr. Abubakar Siddique Mohammed is still with me. He's the Vice Chairman at Anap Foundation think tank. Yes, Dr. Mohammed, this seems to be a better picture. I listened to you in all your submissions. What do you think, or which do you think is the weakest link out of all the things you enumerated in our fight against coronavirus?
We have to intensify behavioral change communications. We have to intensify it. People, we've done a lot of publicity. People even know about COVID-19, but their behavior has left much to be desired. People don't respect what they are supposed to, what they've been asked to do. People go to the market without face mask. People don't wash their hands. They don't observe social distancing. All these things have to be observed. And so we have to get people to change their behavior. And so from general publicity which we have engaged in since the beginning, since December or January, we have to also switch strategy to basic, behavioral change communication, to get community leaders, to get people to begin to respect these basic things. One, they have to wash their hands regularly with soap or sanitizers, alcohol-based sanitizer. They have to maintain social or physical distancing. They have to do that. They have to also wear masks. They also have to help in identifying symptomatic cases. Secondly, the other thing we have to know is that even those health workers who go to houses to actually pick those who have symptomatic cases have not been trained. The way they go to communities, to pick symptomatic patients, creates stigmatization. I'll give you a typical example. They were informed that somebody was exhibiting some symptoms. They rushed to the place, too fast, one. Two, with siren, with police, with all the state officials, as if the man has committed a crime. They took him, away. And when people see this kind of things, they get scared. They don't even want to go to the hospital to report because of the way they'll be treated. Take the case of that woman in Benue. She went to the hospital, a private hospital, to report that she was feeling some malaria. And then the doctor examined her. He advised her to actually spend the night in the hospital. She was there. She spent the night in the hospital. She was in the hospital without any information. The state governor actually went on television immaculately to announce that the first index case in Benue State has been detected. The woman didn't even know. Somebody called to tell her that the governor is giving a press conference mentioning your name. And the next thing she saw was a deputy governor with an ambulance, with police, and so on and so forth, going to that very particular hospital to take her, whisk her away, as if she's a criminal. This is not done. Some years back, I was in London when the ambulance workers went on strike. The government decided to use other drivers to actually drive the ambulance. And the way what we saw in Nigeria, what we are seeing in Nigeria, was what those untrained drivers did. They rather complicate issues. So you could see basic things as, actually evacuating people from their houses to the hospital are not properly done because those who are doing it have not been trained. And this stigmatization has led to people actually hiding even when they should come out. Sickness is not a crime, and people should know that. Now, when we move from this, we go to the hospitals. By now, we should have stockpiled enough PPE. In fact, those who have effective health system will know that Ebola is only one. Before COVID, we have MERS, we have SARS. And so it's a matter of time, there's another outbreak of a virus actually emerges in the world. And those who are serious, we're preparing for that. If there's, and the world has always had these kinds of outbreak, but our health system, it's not geared towards that. It's not designed, to anticipate the kind of crisis we are facing. So we are always taking, we're always taken aback. This is part of the problem. And so this thing is on us. We have to get the PPEs for our doctors. We have not been able to get enough to give our doctors. Some of them are falling sick because of this lapse. Patients are running away from them. Doctors are running away. It's a major problem. This is not how to fight this kind of pandemic. We don't have enough test kits. As I said at the beginning, it is not the fault of anybody. We have not planned. Even the United States, UK, do not have enough test kits. And so because we don't have enough test kits, we don't even know the people who are asymptomatic in Nigeria, except when people go or when people feel sick and they call the NCDC people. And that's what we are doing.
Okay.
We are not testing enough. Therefore, we don't know what.
Okay, doctor.
And so if you are not, you can't even plan. You can't even plan properly to deal with the
Doctor, I hear you clearly. Doctor, I hear you clearly. Let me just come in with this question. Also, in your earlier submission, you did talk about the lockdowns and what we've seen so far. definitely from your own analysis, the strategies we've put in place is not working. Even from what you've said right now, our communication strategy has got to change. People need to adhere to, the guidelines of physical distancing, wearing masks and all of that. Let me come to the issue of the lockdowns. Do you think that the full and the partial lockdowns that we have right now are yielding fruits?
I wouldn't say it is totally nil, but what I'm saying is that it didn't work in the sense that when you lock people down, like it was done in China, you should be able to fend for them, isn't it? You should give them food, you should give them palliatives. You lock people down, and majority of our people actually live from hand to mouth. They go out every day to make a living. That's what they do. Now, if you lock them down and you ask them not to go out, they will die of hunger. Now, if you take a case like Katsina, where insecurity is also part of the problem, I saw one district saying, in fact, COVID is even better than some of these bandits. You get it? They have all run away from their own villages. There cannot be any lockdown in this kind of situation. And so people will come out. If they have to make a living and you are not actually supporting them to stay at home, they will come out to earn a living. And when they come out, some of them will actually contract the virus and they will take it back home. In fact, a new study is emerging to show that many people actually contracted the disease while they are at home. They didn't go out. So those who went out came back and then spread the disease. And look at the nature of our settlement. If you take Kano City, for example, a house which was originally meant for maybe 3 people, you now have 100 people living in that house. Look at Lagos, go to Morocco, and many other Ajagunle. How many people live in a room? You get it? It's rubbish. If one of them goes out to contract the disease and he comes back, all of them will get it. And what I've said, and as I said, we don't even have enough test kits to actually know how many Nigerians have contracted the virus. This is part of the problem. We have to do more than we have done. We have left Egypt, but we have not reached Jerusalem yet.
What a succinct way to put that. We've left Egypt, but we've not gotten yet to Jerusalem. Let me also take you up on what you said in terms of observing those guidelines, physical distancing, wear a mask, wash your hands with water. Do you think that because of economic, the economic strata right now, a lot of us are poor? If you've seen the kind of, your analysis earlier, which you mentioned, take a look at people living in crowded places. We have a lot of slums in Nigeria. Most of those settlements do not even have running water. So we need running water to wash our hands, yes, this period. We need to observe physical distancing. You see a lot of people, they can't observe that because of the kind of place they are. So do you think that poverty is also, helping to spread this disease further? And if it is, what can government do quickly to be able to ensure that our communities are equipped to adhere to some of these guidelines?
Yes. For example, certain days people are asked to go to the market, isn't it? What we should do is at the entrance of the market, we have soap, water. We ask people to wash their hands before they get into the market. Some of the market, in fact, the markets are even safer than some of the houses. I can tell you because it's open. If people maintain social distancing or physical distancing of 2 feet or 2 meters, and they talk, even if they don't have the mask, the possibility that they will get contract the virus is minimal. In the sense that when they talk, especially in the heat in this part of northern Nigeria, it is likely going to fall, and it will not get straight to their ears. The virus is likely going to fall. It's not going to get straight to their ears or their noses and things like that. But the most important is to have a face mask. Nigerians have become very, very ingenious. Tailors are producing many of these face masks. I've seen on television in some countries, governments took the initiative of giving people free face masks, And so some of these tailors who have now switched to producing face masks, government can buy it from them and begin to distribute it to the poor. There's nothing wrong in that, And the same way we should also make sure that those who cannot feed, those who can't go out to work, are also supported. The poor are supported. Poverty is certainly going to is contributing to that. I've read a lot about the pandemics, from the 13th century to the present day. The poor suffer. The poor always suffer. In fact, in the 14th century, the rich ran away and then went into the mountains in order to separate themselves from people dying, especially in Italy. Okay, but what is happening today with this pandemic, which is new? Of course, the poor are suffering. Okay, but the rich are not also free either. You see, this virus is like death. It sends people to their grave, but it has one characteristics. It share one common characteristic with death. That is to say, it does not separate the poor and the rich. They all die if they contract it. So we have to be very serious about it. If the rich think they can, for example, isolate themselves, you cannot do so in the case of this coronavirus. The Vice President of the United States, do you see him on screen anymore? You don't see him. His aide contracted it. The Prime Minister of England, United Kingdom, where is he? He also was contracted the virus. He had to be cured in a hospital, state-run hospital. And so we have to be very, very serious. The point I'm making is that we have to be very, very serious, even after this, before the end of this pandemic, to take a hard look at our health system. It has broken long ago, and this the outbreak of the virus has actually brought it out clearly to everybody to see. We do not have an effective health system in this country. Now, those whose job it is to protect us and to give us effective health system are now also at the receiving end. They should know that this virus will not leave them. In the past, they would have run away to the United Kingdom, to the United States. They have locked their borders also. They can't go anywhere. They have to live here in Nigeria with us, to brave it out, And so what they have done in the past has come to haunt them, or has come to haunt the country. We thought that you can ignore the health service, the health sector. It is you can run it like a capitalist enterprise. You get it. No more social enterprise. That's what we were told by the World Bank and the IMF. It's not a social. It has to be capital intensive. It's no more a social service.
Okay.
But if you say it has to be, people have to pay for their services and they are poor, they will get sick. When they get sick, especially like what is happening today, and they contract a virus or any disease like Ebola, they will spread it. And if you don't have effective health system to deal with it, you cannot even escape it. The rich cannot even escape it.
Okay, Doctor. You are the Vice Chairman of Anap Foundation think tank. Bringing me to the question of what you were just talking about in terms of the government needs to sit up. Where the government is not sitting up, we've seen a lot of private sector help, a lot of private sector support. Anap Foundation, which you are the Vice Chair, have been releasing, press releases have been reading. I also spoke to the Chairman at Edo Peter side of Anap Foundation some weeks ago. Speak to me where we are right now, that is from your own foundation perspective.
You see, to fight, as I said, this pandemic, first, let's start. What is the role of the state? The role of the state is protect life and property. Now, when you have pandemics such as COVID-19, if you're in Nigeria, you know that the state alone cannot handle it. It cannot handle it. The system it should put in place to deal with it does not exist. So you can't leave them alone. They have started doing something. We thank them for doing it. But all hands must be on deck. To deal with this pandemic, you have to deal with three things. Number one, you have to deal with the health system. So it's medical. You have to deal with governance. You also have to deal with communication. And so Anap Foundation came into it because we recognize that you cannot leave the fight, this serious fight against COVID-19, to government alone. We have to also put in come in and put in whatever we have in order in this fight. That is what why Anap Foundation was established. Okay. Now, like our chairman used to say, we act like a goalkeeper. A goalkeeper, if you watch football, a goalkeeper is at the back, but he sees what the other players don't see. He sees what the other players don't see. And so before a free kick is taken, he tells the various players the position. He positions them in order that the opponent do not score. So that's what we are doing. We study what is happening globally. What are the global best practices? In fact, in the Anap Foundation, we have doctors, epidemiologists, well-renowned in it, like Professor Yele Aluko. We have Professor Kayode of the University of Ife, one of the leading epidemiologists in Nigeria. We have the chairman himself, who is a banker, who has traveled all over the world. We have people like Bishop Kuka. We have Lucy. We have, in fact, take all the various aspects, of life in Nigeria. We have people in that foundation, and so we brainstorm to find out what is the problem. What should we do? What should we tell the state? What can we do on our own? Like, for example, we have volunteers across the country. They feed us information about what is happening in their various localities. And so this information we gather and we brainstorm on them and come out with the kind of press release you will see. And then we also share it with those who need to know and those who are leading us, they need to know. So that's why we have to fight this pandemic. You need doctors, epidemiologists, you need, the governance has to be proper, you need communication. Communication is very, very effective. It's not just to tell people wash your hand. You should tell them, by washing your hand, this is the consequences of it. Or by not washing your hand, this is the consequence. You tell people to wear face masks. It's not easy to wear face masks. But you tell them, if you wear face masks and somebody is talking to you who is symptomatic, you are likely to protect yourself against the disease. In fact, if you don't do it, it's penny wise, pound foolish. Okay, so it's your interest to do it. So many organizations may come out if the state has failed, like Anap Foundation, like Dangote, like Otedola, like Abdul Samad, like Fola Adiola, and all of them are there. And I'm very sure they are also doing their best. Some are building hospitals. Some of them are equipping empty houses with beds. Very soon they will also move in to begin to supply, some of these things I've mentioned, like water in strategic places, like masks, like I've seen in Korea, in China, as people come out, as they are going into a crowded place, somebody is there to give them face masks. Some of them, some is there to take their temperature. Somebody is there to ensure that they wash their hands with soap or sanitizer. This should be done in Nigeria, since it seems to me this war is going to take a long time. No vaccine has been developed yet. No drug has been developed to take care of it. When people go to the hospital, what they do for them is to take care of the secondary diseases, to fortify them, to resist. That's one more professor, to resist the virus. So insofar as we are going to be with this for a long time, these simple measures have to be reinforced.
Okay. Since we are going to Doctor, from your analysis now, since we're going to deal with this for a very long time, COVID-19, coronavirus pandemic is here. I don't think in the next 2, 3, 4, 5, 6 months we'll be out of it yet. What does it portend, especially for state governors? Give me your own analysis of how we're handling this, especially state governors, especially the North, even where you are right now. Some governors have come up to say, fine, we're reopening it. Even some, I think, during these festivities and all of that. How would you characterize that for me?
You see, leadership is extremely important in times of crisis. It is in times of crisis you show good leadership. Some governors are showing leadership. They are leading, while others are being led. That is the problem. In Kaduna State, maybe because the governor himself was a victim, he's very serious, he's leading. He's not just giving orders, from what I've gathered. He also discusses with stakeholders to tell them why certain things have to be done. Now, anybody who has studied political science will tell you that when laws are passed or regulations are made, you have to actually go into discussions with people, explain to people why those laws are necessary. Many will respect them. Okay, some will not. You see, the whole idea about going into dialogue with them is that to reduce those who will break the law, the number of those who will break the law. So you have the majority not breaking the law, you cannot deal with the minority. You get it? Who are bent on not respecting the law. That is why you have the police. That is why you have the army and all other security services. This is what is happening in Kaduna. In some states, you know, the governors initially did not even accept that there was this virus, or the virus was spread. They saw it as something which is happening far away from Nigeria, so far away in China, in the United Kingdom, and so on and so forth. So they did not prepare effectively. In fact, what is shocking is that, for example, in Kano, the governor set up a committee, this COVID-19 committee. Half of the members of the committee contracted the virus. They were isolated. But no, that was not enough to tell the governor that something seriously is happening in the state to take action. That was not done. People started dying. In fact, what is interesting in the case of Kano is that what we knew were when important people started dying, professors, you know, former ministers, former ambassadors started dying. That's when people started asking questions, what is happening? And people, those who have gone to the graveyard, started seeing more bodies coming. Day before yesterday, I was asking a colleague in one town. He said, I've just come from the 10th, you know, condolence visit. Every day, I count about 15 people dead.
Mm-hmm.
Now,
the question is yes, are those coronavirus deaths?
Or not? Yes.
Are those coronavirus related deaths? Why haven't we been able to ascertain?
What has to be scientific? What the local people will tell you is that the number of people we bury every day before the coronavirus, you get it, is far, far lower than what we are burying, okay? Because no test is conducted to say why are people dying, and people have left to speculate. One guy told me that it's because of the heat. You know, if you take a town like Katsina, many people are dying. You take a town like Azari, many people are dying. I know many who have died. In Kano, many people are dying. In Samaru here in Zaria, yesterday my staff told me that about 4 people were buried. Okay, these are local people. They know the frequency of death in their own localities. If they see a change in it, they tell you. They will know something is changing. They will say there's an Oba. You get it, there's an epidemic. You get it. But what kind of epidemic? What is killing these people? Nobody knows. Because we don't have enough test kits. We don't perform a post-mortem examination to establish that. If it is not COVID, it means there's another disease, okay, or virus in this community, which is killing people. We don't know. We don't know. If it is COVID, you know, one night killing people, do we have enough facilities to deal with it? As I told you, doctors are running away. Even in private hospitals, they are refusing to admit patients. You go to government hospitals, the doctors have run away. Even in Abuja, something is wrong. Something is wrong, and we have to address it. You know, we have long-term and short-term solutions.
Doctor, where do you think that leadership should come from? Because from what you're saying right now, apparently, perhaps communication is lacking there if those deaths are increasing, according to what you're just telling me right now, that people are dying every day. Either we are not reporting it, or no, it's being reported and no one is taking cognizance of what is happening right now. So where should that leadership come from? Since you said some governors are leading, some governors are being led, where should that leadership come from?
If we don't take care, we are going to have social upheaval in many states in the north. Even Lagos, you know, people started, you know, coming out, defying the governor, despite the fact that they are doing very well. Lagos State is doing very well compared to other states. You know, if you lock people up, you know, and you do not fend for them, they will defy you. There's no doubt about it. They will come out. You know, when they come out, they will not come out prepared. They will not respect those guidelines, and they will spread it the more. Now, what has happened in Nigeria, in the area I live, I don't mean Kaduna, in the north, is that people do not trust their leaders anymore. People do not trust their leaders anymore. They see them as liars, as selfish people. People who come and rig elections and go into government house and forget them. And so they don't respect them. So there's no trust. You cannot fight COVID-19 when people have no trust in the leaders. Take what happened in China, what happened in Korea, what happened in Singapore. You know, people, when the leaders talk, people know that they mean business. They will respect it. And they also have infrastructure to deal with it. We don't have that. You know, you ask people to be at home, you know, to respect the lockdown. They fall sick, they go to the hospital, the doctors run away from them. This is a problem.
Okay.
You know? And people are beginning to challenge their leaders. People are beginning to challenge their leaders. That is why they come out. You know, they come out, whatever the leaders say, they come out.
Okay, Doctor, let me take you back a bit to what you said earlier, which also hits me, which is the method at which people that have tested positive are being whisked away. You raised that very salient point, yes, which is they come with the ambulance, with security agents and all of that. Tell me, what could be the alternative to taking COVID-19 positive patients to the treatment centers?
Not every driver is trained to be ambulance driver. That's what we have in this country. Anybody who can drive a vehicle is given an ambulance to drive. Ambulance drivers are trained, and the health workers who go to whisk away those who have tested positive are also trained. They don't go there like they are going to arrest a criminal, an armed robber. No, there's compassion in the way they do, in the way they even go to the house, you know, the way they relate with the people. Some of them even use the opportunity to further drop one or two, you know, words of caution, how people should behave, you know, and assure them and take the patient away. But when you go, like you are going to arrest an armed robber who is armed, you know, in his house, you know, you scare people. You also stigmatize those who have this kind of sickness. This is what is happening. And so they will hide if they are sick.
Okay.
Even the neighbors.
Okay.
So we have to, basic training is lacking. What we have is that we have doctors at a higher level who know what to do. At the lower level, you know, people don't have the skills. And yet doctors cannot perform effectively if those ones at the lower level are not properly trained, okay? If, for example, they don't take a patient to the hospital, will the doctor do anything? Okay? He can't do anything.
Okay.
If there's no test, he can't do anything.
Okay, Doctor, I get you. I just needed you to bring in that point, because that was a very salient point you made, and I didn't want it to just go by the way, because that's what we've seen so far, that when an ambulance comes into a community, every other person around the community is scared. Or when an ambulance comes and you hear that and you'll be like, oh, there's a COVID-19 positive person close by, and you also go into hiding. But let me also take you back to what we were discussing earlier, talking about the governors and their handling of this. And let me come a bit to the northern part. We've seen the topsy-turvy kind of, you know, handling of the almajiris in the north. Speak to me about it right now, because the governors have also said, let every child go back to their state, especially now that we are fighting COVID-19. What's your own analysis of it?
You see, we are just postponing the evil day. You know, for a long time, some governors have wanted to end the system. Certainly, the Almajiri system, I've written a paper on that. The Almajiri system has been abused over time. You know, it's not very good. In fact, I wouldn't wish the son of even an enemy to be an Almajiri. You know, there's no doubt about it. If you look at the history, it had a glorious past, but in recent times, it has been abused. It has been abused. So many governors, you know, had wanted to abolish it totally, but they came, they met serious resistance from the Malams, you know, who are this Almajiri, who go out, you know, make a living for themselves and at the same time bring something to the Malam. That's what they do. And you have parents who have said some believe it out of religious, some have really, some believe that it is good for the kid to be sent out so that he is toughened, you know, up, you know, for future challenges. Some actually is a way of getting rid, you know, of a burden. You get it. By the time the boy comes back, he has been toughened up and he has become a man. Now, as I said, the system has been abused. And those who are benefiting from the system will fight you to the end. I'll tell you what happened to me last year, the year before last. A conference was called in Kaduna, and I was invited to present a paper on the Almajiri system. I'd studied the system from Mali, Senegal, Gambia, up to Nigeria, and then studied the history and go. So I started giving the history of the Almajiri system. When I got to this level of abuse, there was uproar. They nearly attacked me. You know, those who benefit from the system. I held my ground. I kept quiet. You know, when they stopped their shouting, I took the baton to them again. You know, this is the situation. So the governors want, many governors, especially the governor of Kaduna State, had even passed a law, I think, to prescribe it. But he came under intense pressure from those who benefit from that very particular system. Now, what the governors in the north have done is that the COVID-19 situation give them an opportunity to get rid of the Almajiri system, to use the armed tactics to actually get them out of their states. And so they started sharing their own, transferring their own Almajiri. Kaduna would transfer Almajiris from Katsina back to Katsina. Katsina will take those from Sokoto to Sokoto to Zamfara, and so on and so forth. But if you do that, that is the case. If you do that, you send them home. Do you have schools to send them to? Have they planned how to rehabilitate these children? Not all of them have this plan. So you send Almajiri back to their state, you get it. It's a matter of time they will come back after COVID, when you don't have all the police to run them up. But if you send them back, and then you begin to give them skills, you educate them, you give them skills, you know, they will not come back. I'll give a concrete example. Some years back, late Alhaji MD Yusuf was at home in Katsina. One man came to him and said, "Sir, wallahi tallahi, if you don't take care, it's a matter of time. People like me and you can never enter Katsina town." Alhaji MD Yusuf, the intelligence officer that he was, he said, "Why can't we enter Katsina?" He said, "You know, sir, if you are entering Katsina, do you see this Almajiri? You know, Almajiri means is a plural of Almajiri. Almajiri is one, Almajiri is many. Okay? So he said, do you see this unemployed Almajiri and non-Almajiri? You know, some of them take Indian hemp, some of them take all sorts of drugs and so on and so forth. One day somebody will organize them, they will attack us." Then he asked that boy, "What do we do for that man? What do we do?" He said, "Let's give them skills. Let's give them skills." Alhaji MD Yusuf then said, "How do you go about it?" He said, "I'll go and get a building, rent a building in Katsina, and then wait the process." Alhaji MD Yusuf said, "Go and get it, I'll pay." So they rented an apartment in Katsina, and they brought some of these unemployed youth, Almajiri, and started giving them basic skills. In what? In how to repair handset, how to repair radio, how to do so many things. In fact, there was a leper who was a beggar. The day he was graduating, he cried and said he never thought a day will come when you have a skill and even make money to help others. Because the skills they have, you know, is such that they can earn their living without having to beg. They can also take care of their family. Okay,
Doctor, if you can hear me, we just have about 2 minutes to the end of the show, and use this 2 minutes to answer these two questions. So it's a rapid fire question, and I need rapid fire answers. You have a background in energy economics and policy. Talk to me about how far you think that the Nigerian economy can fare within this coronavirus crisis, very quickly. Then the last question is, today, tomorrow is a public holiday. Our Muslim brothers and sisters